Hello, everyone. Welcome to LUMP's Auricular Medicine course. We start with introduction and anatomical terminology. Auricular medicine is easy to learn and master. Ear acupuncture tools are not costly. Regardless of which modality is selected for treatment, the equipment required for ear acupuncture is minimal and relatively inexpensive. Ear acupuncture can be used as an exclusive and independent modality or as adjunct to therapy to enhance and reinforce treatment initiated through other methods. Results obtained from auriculoacupuncture are quick, effective, time-tested with over a 2,500-year history. Ear acupuncture is a non-invasive technique that is convenient to patient in terms of ease of administration and promotes patient compliance through self-treatment. Auricular medicine has a broad range of applicability to numerous clinical conditions, including diagnosis, prognosis, treatment, prevention of disease. Like body acupuncture, ear acupuncture can be used for treatment of diseases of internal organs, as well as musculoskeletal and emotional problems. Ear therapy is particularly effective for treatment of pain, inflammation, skin disorders, and can treat both acute and chronic disease. Ear can be used successfully for every clinical condition, producing at least a 90% success rate. Like body acupuncture, if properly applied, the strength of auricular acupuncture is that it stimulates the body to heal itself according to principles of balancing yin and yang and promoting proper organ function. Ear acupuncture works best when it treats root over symptoms. Regardless of specific illness with which you are dealing, you must always keep the pathophysiological cause in mind. Only then will you be able to get to the root of the disorder. Now let's go to anatomical terminology. We'll discuss the 21 anatomical zones of the ear, and we'll distinguish the regional anatomy of the ear. This is the simplified illustration of the ear, the external ear. Now let's discuss the parts of the anterior aspect of the ear. The helix is the outermost portion of the auricle, consisting of a rim-like structure. Crus of the helix is the beginning of helix. It originates in the cavum concha. Tubercle of helix is a small appendage on the middle border of the outer rim of the helix at the junction of upper third and middle two-thirds of the helix. It is also called Darwin's tubercle. So this is the helix. The outermost portion of the auricle consisting of a rim-like structure. And this is the crus of the helix. So the crus of the helix is the beginning of the helix. It originates in the cavum concha. The tubercle of helix is a small appendage on the middle border of the outer rim of the helix at the junction of the upper third and middle two-thirds of the helix. It is also called Darwin's tubercle. Many patients have very subtle and undefined tubercles. Hence, we must infer where it would be. To do this, divide the length of the ear into thirds. Tubercle is roughly at the junction of upper third and lower two-thirds of the helix. The scaphoid fossa. Fossas are depressions. Scaphoid fossa is depression between the helix and anti-helix. It is sometimes called scapha. The ear apex is the height of the helix. If you gently fold the ear apex is located at the top of the helix where the fold occurs. So this is the scapha or the scaphoid fossa. As we have learned, it is a depression. Scaphoid fossa is a depression between the helix and the anti-helix. The apex of the ear is the height of the helix. If you gently fold the ear apex is located at the top of the helix where the fold occurs. Anti-helix is elevated ridge-like structure medial to the helix and running parallel to it. Anti-helix and helix are separated by scaphoid fossa and it has three parts. Superior anti-helix crus, the more lateral superior branch of the anti-helix, bifurcates off the lower anti-helix crus at lumbago point. Inferior anti-helix crus is more medial, inferior branch of anti-helix, bifurcates off the lower anti-helix crus at lumbago point. So this is the anti-helix, the elevated ridge-like structure medial to the helix and running parallel to the helix. Anti-helix and helix are separated by scaphoid fossa, and it has 3 parts. The superior anti-helix crus is the more lateral superior branch of the anti-helix. It bifurcates off the lower anti-helix crus. So this is the lower anti-helix at the lumbago point. So this is the lumbago point. The inferior anti-helix crus is the more medial inferior branch of the anti-helix. It bifurcates off the lower anti-helix crus at the lumbago point. Now let's review the anatomy of the auricle. Number 1 is the helix. Number 2 is crus of the helix. Number 3 is anti-helix. 3A is superior crus of the anti-helix. 3B is the inferior crus of the anti-helix. 4 is tragus. 5, anti-tragus. 6, intertragic notch. And 7 is the lobule of the auricle. The lower anti-helix crus is at the lower portion of the anti-helix. The inferior and superior anti-helix crura bifurcate off the lower anti-helix crus. The triangular fossa is a triangular depression bordered by superior and inferior anti-helix crura. So this is the lower anti-helix crus, the lower portion of the anti-helix. The inferior and superior anti-helix crura bifurcate off the lower anti-helix crus. If you remember, this is the lumbago point. Triangular fossa is a triangular depression bordered by the superior and inferior anti-helix crura. Now let's discuss the conchas. Cavum concha is the inferior portion of the auricle that has a concave surface, separated from the cymba concha by crus of helix and lies inferior to the crus of the helix. Cymba concha is the interior portion of the auricle below the inferior anti-helix crus. It lies superior to cavum concha with the crus of the helix dividing them. So this is the cavum concha, the inferior portion of the auricle that has a concave surface, separated from the cymba concha by crus of helix, and it lies inferior to the crus of helix. The cymba concha is the interior portion of the auricle below the inferior anti-helix crus. It lies superior to the cavum concha with the crus of the helix dividing them. The tragus is a small ridge-like flap connected to the lateral portion of the face. It is directly anterior to the external auditory meatus. Supratragic notch is the indentation above the tragus. Intertragic notch is the indentation below the tragus. Antitragus is the bump-like structure at the inferior diagonal angle to the tragus. The lobe is the lowest portion of the auricle. The lower border of the intertragic notch demarcates the lobe's upper border. The external auditory meatus is the canal medial to cavum concha behind the tragus that conducts sound waves into the inner ear. The tragus is a small ridge-like flap connected to the lateral portion of the face. It is directly anterior to the external auditory meatus. The supratragic notch is the indentation above the tragus. The intertragic notch is the indentation below the tragus. The antitragus is the bump-like structure at the inferior diagonal angle to the tragus. The lobe is the lowest portion of the auricle. The lower border of the intertragic notch demarcates the lobe's upper border. External auditory meatus is the canal medial to cavum concha behind the tragus that conducts sound waves into the inner ear. So this is the external auditory meatus, the canal, and this is a tympanic membrane. So this is basically the anatomy of the outer ear. Now let's discuss the posterior aspect of the ear. The root of auricle or ear root is a depression on the posterior aspect of the ear just above the tendinous flap that connects the auricle to the head. The hypertension groove is the groove-like depression formed by posterior border of the helix. It runs in the upper third of the groove on the posterior aspect of the ear. The posterior aspect of the ear proper is the rest of the back of the ear. So here is the posterior aspect of the ear. Thank you very much for your attention. See you on our next video.